everyone in Facebook and Twitter world. Happy to be back here on the Arthritis Broadcast Network, bringing you up-to-date stories, research, and experiences from the Canadian Rheumatology Association and Arthritis Health Professional Association's joint scientific meeting in beautiful Victoria. I'm here now with Alex Charlton, a pharmacy clinical practice leader at the Alberta Health Services. We're very blessed to have this opportunity to hear from a pharmacist. So I wonder if, Alex, you could start us off just with a little bit about you and your relation to rheumatology.
Okay, so I am a clinical practice leader, which means I have a lot of pharmacists under me, but my own clinical practice is by choice, rheumatology. So that's about 40% of my time. I also then sit on the Bone and Joint Strategic Clinical Network, which is an Alberta Health project with various different groups. So that's one of them. So it's committee work and research and writing papers and stuff is also a big part of my job. I started in rheumatology because I've had rheumatoid arthritis for 29 years now. And it just kind of got pulled in over time, and there was an availability for me to go in and do some clinical work in rheumatology, and so that's where I've been the last 12 years.
Very cool. It's great to have this opportunity to share with other patients, and we, as a coalition, bring a great perspective to, I think, these very scientific conversations. So I'm wondering if you could share with us, what are the types of questions that you get asked by patients in your clinic, and what are those major concerns that they share with you?
So a big thing that I get a lot is concerns that are brought up. They leave our clinic, they're okay, they go to fill their prescription, or they talk to their family doctor. They give them the handout with the many side effects on them, or they give them their opinion of the drugs that they don't know a lot about, and all of a sudden I get the phone call, I'm not going on this, what are you trying to do to me, you didn't tell me any of this. And I find that quite difficult. Their biggest concerns that usually get told to them are if they're being counseled on biologics, basically you're going to get a bad infection and you're going to be very sick and your immune system's going to be shot. The cancer risk is often brought up with most of the drugs. And that's really the big things I get. I also do a lot of pregnancy counseling, so family planning. I get referrals for that quite a bit to help people kind of plan what we're going to do, what meds we're going to change, and all of those kinds of things.
And what do you say when folks call you saying no?
So they get booked into my clinic. So I do several different types of clinics. One is a referral clinic, and so if they're calling in and they have concerns, often I find it hard to do it over the phone because I like to show them things and explain things and how they work and different things like that. I find it much easier than over the phone, if they can. And then we'll just sit down and I'll show them how biologics work. I'll give them some information and go over that information with them, and I have a probably 98% success rate of when patients say they're not going to do it. And that's what a lot of my referrals are from the physicians is, this patient is very nervous about going on, can you please talk to them? So that's kind of what I do.
Yeah, that's definitely something that we as an organization face a lot, is how do we support patients navigating this very complex kind of scenario that they're not really used to. So what would you recommend for patient organizations attempting to support not only patients, but also the flip side, which I guess is community pharmacists?
I think it's really important to provide community pharmacists with information, because a lot of times they're the ones that the patient already has a relationship to. Like, they come to clinic, we start them on drugs, they've met me for one appointment, but they go and talk to their pharmacist that they know, or their family doctor that they know, and they get that misinformation, and they're more likely to kind of trust them because of their long relationship. And so it's such a small amount of their practice. It's not like it's high blood pressure or diabetes or something like that where they have hundreds and hundreds of patients. One pharmacist may only have a few patients over the course of a year on some of these medications. And it kind of depends who's taught them about stuff. And so if there's information in the pharmacy that they can refer to, if there's any kinds of seminars or anything like that that can be provided, I think that would be really helpful.
Awesome. Yeah, definitely something that I think we're all interested in. So I'm going to maybe shift gears a little bit, and you kind of alluded to it, but there's a unique scenario now happening in Alberta around the biosimilars policy. And I'm wondering if you can share, your experience so far, and then also how do you explain this policy change to patients?
So we've had a lot of misinformation in Alberta. As you may or may not know, it's a very heated political climate in Alberta right now. And the recently ousted, now the opposition party, was bringing in a lot of people and creating a lot of anxiety in people about switching to biosimilars. I felt that the media did a very bad job of reporting them. They were calling them biosynthetics. They made it seem like biosimilars weren't even a biologic. And it really got people worked up, and then it would kind of settle, and then the opposition party would hold a rally in front of the thing, and it would be in the news again. And so we had these peaks and valleys of people freaking out based on what they saw or the headline they read or something like that. Patients who come in, and I teach, actually that's how we're dealing with it in our clinic, is I teach a biosimilar class every week.
Oh, cool.
And so the physicians provide me with their prescriptions, and they sit for about 20 minutes, and I talk all about biologics. I explain the differences with generics and biosimilars, how biosimilars and biologics are made, the process of how they get approved, and then I talk about how the money that we save from biosimilars can help provide further coverage for up to 100 patients, depending on which other biologics they are. So my last slide is kind of, for every 100 patients that we switch, we can have 50 on abatacept. We can have like 75 on biosimilar etanercept and those kinds of things. So really, after I've been done, I've not had anybody who was concerned once they kind of just sat and listened. And directly in clinic, when we have patients in, a lot of patients weren't concerned because we were comfortable with it.
Yeah. And do you have resources that you rely on to share, or are they just your webinar or your future webinar?
No, we have resources there with the books that you guys put out, and we have some other stuff that was provided to us from unbranded from some of the biosimilar companies, but nobody's actually taken them. By the end of my class, I must be telling them what they need to hear, because I haven't actually had anybody that really wanted to get more information.
That's fantastic. And we know, as Ontario follows, and potentially other jurisdictions, that these types of resources are so important to support patients in getting access to treatment that they need. I wonder if we can kind of focus on what we're doing right now, and whether you could share some of your reflections and excitement from attending the CRA meeting right now.
Sure. I think the most interesting part for me, I went to both lectures by Tim Spector that was talking about the microbiome and the various different supplements, and a few supplements that I actually recommend. He said they don't do anything, and they're kind of a waste of money. But I think it's kind of nice that actually they're spending so much time on seminars and things for that, because it's not something we don't know a lot about. We probably should know more about it, but I think that was good to go and hear more more kind of expert opinion on it. I think that was good. I think the coverage that, again, several different ones I've attended on the lung disease that happens to patients with inflammatory arthritis. I think people aren't aware that that's even an issue. They're worried about methotrexate doing it, but they're not worried about the disease doing it. And I think it's good that there's treatment for that as well.
Very cool. And so we know that this year's theme is on 2020, the next decade in rheumatology. And I'm wondering, based on your experience, a few years of experience, where you see arthritis care and research going in 10, maybe 15 years.
So I don't even think I can predict. I mean, I was diagnosed in the era of 6 grams of aspirin plus gold shots, and it 9 years later, all of a sudden, Biologics. And then 10 years later, many Biologics. And now we've got oral pills that work like Biologics. And I don't even think I can predict. I hope people are still spending money and bringing out more drugs and that we have more things available. I think it's important that we have new things come out for people like me who've been through a lot of different medications. I think it's really important that those things keep coming out as people get older and older, and we want to keep their disease under control.
Yeah, and as a patient, you obviously bring a very important and unique perspective that many other experts that we've had here don't.
Mm-hmm.
I wonder if that, and it looks like we might have some questions, but whether that influences your perceptions on and experiences with patients.
It definitely does. I mean, I don't share it with everybody, but certainly I get the patients that are kind of accusatory, like, you don't know what I'm going through, or their anxiety is so high about stuff that I will share, and that settles them right down. Like, you take these things? And I'm like, yep. And you've been taking them for a long time? Yep. And all of a sudden it changes. The attitude toward it changes. Everything kind of changes. So a lot of people I don't need to share it with, but I'm certainly not afraid to share it if I think that's going to help a patient.
Yeah, very cool. And we know in our experience at the CSA, our support groups are so important in sharing patient experience with one another. It looks like we might have some questions. I wonder if, Anita, you want to share those.
Do you have many patients bring someone in with them as a second set of ears?
Yes, and I recommend it strongly because patients are often very anxious. They sort of tend to stop after certain things, so they hear the diagnosis, they hear certain things, and then anything after that they don't hear anymore. Certainly patients who have any kind of language barrier, definitely important. Older people, often I'm being a little bit sexist, but it's kind of what we see is often the wife tends to look after all the medications and the appointments and everything for her husband, and so I really do think it's helpful. And also sometimes they give encouragement to the patient that's needed.
Yeah.
So if they're really worried that their spouse or their daughter or whoever they bring in can say, no, I think this is a good idea, I think you need it, you're not doing as well as you think you're doing, I think that's all helpful.
And where can I get more information on how to attend the classes you're giving?
We have a lot of classes actually in Calgary. So I provide the biosimilar class every Wednesday at 10:30 at Richmond Road in Calgary. We have a Biologics class that I do every other week on Wednesday afternoons. And we have an all-day multidisciplinary arthritis session on the last Tuesday of every month. We don't currently send them out anywhere. We would like to, but there's not a lot of money in Alberta right now, so we're pretty limited on the things that we can do within Alberta Health Services.
Very cool. I think that's time for us to close.
Okay.
Want to give a little shout out to all of our female caregivers, which I think is a good message to bring from this. But also want to thank you, Alex, for taking the opportunity to share a perspective that's not often heard in this conversation, but also from a patient perspective. So thank you for that, and thanks for our folks on the Twitterverse and the Facebookverse and asking those excellent questions.
All right, thank you.